Hello guys, this is Dr. Asif. Welcome to my channel. So it is one of the great opportunity so that I can start the daily sessions. That you all know the previous video I already discussed about the upper limb. Now welcome to my playlist that is MRCS study with me. Today's important topic about the lower limb. So what are these first? We have to understand that not everything is needed for MRCS party. There are some specific things which is very much emphasized by the examiners about the topics of lower limb. Now here is it is the contents. First the some bone parts, then the muscles. Now the muscles of pelvis. So these are the name of the muscles and their nerve supply, which is important, and some foramens and the vascular supplies like artery, vein, nerves, and their distributions. And there are some important triangles or locations of with various neurovascular structures along with their relationship, which is important. So let's start. First of all, there's some bony pelvis and lower limb. So it is a leather knots, which is very much popular. So some of the members edited this book, but it is a very much important content or resources where you can start your primary preparation. So first here is some bones pictures which is derived from later. You all have these books, and now it is very important to see each and every topic with the related pictures. So these are all the muscle attachment along with the bones. So long bones, patella, the nerves of the muscles. So some foot anatomy, some ligaments. There are some questions here I will discuss later on. Now first the muscles. Here the pictures is taken from the Gray's Anatomy student copy. It is very much diagrammatic pictures, very important with a very important relationship. First the gluteal muscles. Okay, so gluteal muscles insert in the gluteal tuberosity. First make it point. Gluteal tuberosity. Gluteus insert in the gluteal tuberosity of femur and the iliotibial tract. And medius and minimus. There is three muscles: gluteus medius, minimus, and maximus. So medius and minimus is inserted. Medius inserted in the lateral greater trochanter, and the minimus attached to the anterior greater trochanter. Another important is all extend the abductor of hip. These are called the abductor of hip. Remember this. Following which muscles those are involved in abductor of the hip. In that case, these three muscles will be the answer. Now the deep lateral hip rotators. Hip rotators means we already know that hip joints is ball and socket type of synovial joint. So it has a circumduction type of movements. So hip joints need to be laterally retracted or rotated by some muscle, that is piriformis, gemelli superior inferior. Okay, obturator externus internus. Piriformis is very small muscles which divides superior and inferior gluteal foramen, and the others is obturator internus and quadratus femoris. So here you can see this is the quadratus femoris. Let me highlight first pencil. So here this is the quadratus femoris and this is the piriformis muscle. Okay, and this is the gemelli muscle. So you know This is very important. So these muscles here, they will retract the or rotate the hip joint here. They will go here. So quadratus muscle, piriformis, which is uh, sorry, this is not piriformis. This is obturator muscle, obturator externus. And this muscle, this little muscle, this muscle divide the sciatic foramen. So above this is greater sciatic foramen, this is the lesser sciatic foramen. So there are some vessels and muscles. Maybe this is the obturator externus, okay, and some vessels, that is pudendal vessels, obturator externus or internus. Later on, I will discuss. And these small muscles is called piriformis, which divides the greater sciatic foramen at least. So these all are muscles together called the abductor of the hip. Now the important topic is the nerve supply, superior gluteal nerve. Okay, very important. Superior gluteal nerve supplies gluteus medius and minimus. You must I already highlighted with these several colors and their importance. So get see the colors, because these colors indicates different kind of importance. The superior gluteal nerve, that is L5 and S1. Remember this. This will supply the gluteus medius and gluteus minimus. These are the called the abductor of the. These are the called adductor of hip. Adductor. So you must know this, these are the adduction. This helps in adduction, these two muscles. And the inferior gluteal nerve and the gluteus maximus. So inferior gluteal nerve, that is inferior 5 to S1. This is called the 4 to S2 downwards. The damage of the superior gluteal nerve will result in patient developing a Trendelenburg gait. Try to remember this. Damage of the superior gluteal nerve will result patient of Trendelenburg gait. So it occurs due to the paralysis or abnormal movement of the gluteus maximus. Uh, the affected patients are unable to abduct his thigh and hip joints. So I will abductor of. So this is the abductor of hip. Okay. During this tense, the weakened abductor muscles allow the pelvis to tilt down. Sorry, this is not the abductor, adductor of the hip. So if I erase it, so eraser is not working. It will be the adductor, not abductor. This is abductor, not adductor. If I go here, cut. So now just let me correction it. That is abductor of hip. Okay. So superior gluteal nerve or gluteus maximus or gluteus minimus, these two muscles along with fascia lata, they are helping about the abductor of the hip. During this tense phase, the weakened abductor muscles allow the pelvis to tilt down on the opposite side to compensate the trunk weakness side to attempt to maintain a level pelvis throughout the gait. No need for that further. So here obturator internus, that you know, inferior gluteal nerve goes from the greater sciatic foramen. Superior gluteal nerve is also from the greater sciatic foramen and the sciatic nerve. So this is gluteus maximus. Now There are some pelvic and hip muscles. That is iliacus, psoas, and pectineus. These three muscles, iliacus, psoas, and pectineus. These three muscles along with the rectus femoris and sartorius. So anterior compartment of the thigh. So from the very front, iliacus, psoas, pectineus, rectus femoris, and sartorius. These five muscles supplied by the femoral nerve, and also femoral nerve. So anterior compartment of the thigh, and their root value is same, lumbar 2, 3, 4. Okay. So lumbar 2, 3, 4 supplied by femoral nerve. It is also supplied to the obturator nerve. Same root value, lumbar 2, 3, 4. Because obturator nerve and femoral nerve are derived from the same root, but anterior compartment of the thigh is supplied by femoral nerve. And the adductor compartment, that is medial compartment of the thigh, the adductor magnus, longus, brevis, and gracilis. So four muscle. Adductor magnus, adductor brevis, longus, brevis, magnus. We usually recapitulate or memorize the adductor compartment as adductor longus, magnus, and brevis, and gracilis. These four muscles, that is obturator nerve, obturator nerve, obturator nerve, obturator nerve. So as we know, these obturator nerve also has same nerve supply, where the femoral nerve also got the same nerve supply from lumbar 2, 3, 4. Pes anserinus, remember it. That is goose foot, like this, like a bird's foot. So four muscles or three muscles are attached to the tibia like goose foot. It's called the pes anserinus, combination of the sartorius, gracilis, and semitendinosus. Remember that sartorius, gracilis, and semitendinosus tendons insert into the anteromedial aspect of the tibia. Okay, that is also called the gyrops muscle. Gyrops like rope. These three muscle act as a rope or sty. It will give greater stability of the knee joint from medially. So in the picture you see a huge flap muscle derived from the transverse of the lumbar vertebra, and they insert into the lesser trochanter of the femur. So iliacus and psoas, these two muscles go through the behind the inguinal ligaments and insert in the lesser trochanter. Good pictures. And so this is the medial aspect of the thigh, which is supplied by adductor longus, brevis, magnus. Another one is a semitendinosus, that is posterior compartment. It is also called hamstring group of compartment. Okay, now the external rotators. So rotators of the hip: gluteus maximus, inferior gluteal nerve, gluteus maximus and inferior gluteal nerve. Number 5 is 2. Okay, now piriformis, obturator externus, obturator internus, gamelli muscle, superior gemellus, inferior gemellus, and the quadriceps, quadratus femoris. So these are the rotators of the hip. Like sometimes it's also called POGO, POGO, piriformis, obturator internus, gluteus maximus, and obturator internus, POGO. Like this, if I here it is, yes, here, see the mnemonic muscle attachment: POGO, piriformis, obturator internus, gemelli, then obturator externus. Sometimes it will be a problem with the gluteus maximus and the gemelli muscle, but gluteus maximus mainly is the abductor of the hip, and little effect on rotation, but gemmelli muscle is formed for outward movement of the hip joint. So this see the landmark fascia lata, gluteus maximus, and their muscle alignment. Now the muscles of the anterior thigh. So muscles of the anterior thigh has that is a deep muscle. Vastus lateralis lies laterally, vastus medialis lies medially, and intermediate, that is in between lateral and medial muscle. Vastus intermedius. Three bulk of the muscle, which is there together forms the quadriceps tendon. These three muscles supplied by femoral nerve, and also femoral nerve. See, this is the vastus medialis, intermedius, and lateralis. These three muscles insert as a quadriceps tendon, that is patellar ligament. Now, muscles of posterior thigh, it is also called the hamstring group of muscle. Let me write here. Hamstring group. It is also called the hamstring group. The biceps femoris, that it has a long head and the short head. Biceps femoris is very important muscles uh, for running, or the athletes. Those are football players or rugby players, or those who are sprint divers. So they need this muscle very much, because for running or sprinting, usually biceps femoris will give the maximum support from very much posteriorly to the knee joints, along with alignment with the hip joints. Some you will find some questions about like that. A patient with a football player, suddenly he feels pain in the posterior aspect of the thigh and becomes collapsed and fall down, and he will not extend his hip and the and flex the knee joint. So what will be the probable muscle damage? So that will be the biceps femoris tendon tear. So usually these two muscles reunited, or in the single manners, it will rupture in the middle of the game. So biceps femoris rupture is common in case of runners or spin divers or athletic injury, one of the muscle injury. The second most important injury is ACL rupture, that is anterior cruciate ligament rupture. So semitendinosus and semimembranosus. So semitendinosus is used as a graft. You must know that it is act as a graft. ACL graft. It is acts as a ACL graft. You can use the graft for ACL from the semitendinous muscle. So anteriotibial, so it is a tibial nerve supplied, and also it is supplied by tibial nerve, semitendinous, semimembranosus. And biceps femoris is supplied by tibial and the femoral nerve. Peroneal nerve lies laterally, so long head lies laterally. Sorry, short head lies laterally, which is supplied by peroneal nerve, and the long head, which is supplied by tibial nerve, most posteriorly. So these things is very important. Let me write common athlete tear. So common athletic tear by the biceps femoris. Now the muscles of the leg. Muscles of the leg. So that is all about the thigh. So muscles of the leg has three important compartment, that is anterior compartment, lateral compartment, and the posterior compartment. So now the anterior compartment, that is consists of tibialis anterior. So all muscles has uh, the term anterior extensor group. So it is also called extensor group of leg muscles. Tibialis anterior, extensor longus, extensor hallucis longus, extensor digitorum longus. It gives supply to the digits, and extensor hallucis longus. So it will give supply to the or give strength to the great toe and the peroneus tertius. And the lateral compartment has two muscles, peroneus longus and peroneus brevis. Okay. So all the muscles, they will supplied by the deep peroneal nerve. Okay. Try to remember deep peroneal nerve, not peroneal nerve, not superficial peroneal nerve. It is deep peroneal nerve. And the peroneus longus and brevis, it is superficial peroneal nerve. Okay. These two muscles only. Thus, see, this is the everters of the foot, peroneus brevis and longus. These are helps in eversion of the foot. So this is the fibularis longus. So don't see it is otherwise. So now the superficial posterior compartment. So compartment posterior compartment has two segments. That is, some are superficial, some are deep. So superficial has three: gastrocnemius, soleus, and plantaris. Gastrocnemius and soleus is together is called the peripheral heart, that we all know. Let me here. That is gastrocnemius and soleus together called peripheral heart. It is also peripheral heart called, and these all are supplied by the tibial nerve. Posteriorly, tibial nerve present. Tibial nerve gives the superficial and deep muscles supplied by the tibial nerve, but anterior compartment is supplied by the deep peroneal nerve, and the superficial lateral compartment supplied by superficial peroneal nerve. So here the bulk of the muscle, gastrocnemius, Achilles tendon, and downwards is called the soleus and plantaris. Soleus here, just beneath the gastrocnemius. Now the deep posterior compartment. Okay, some the deep posterior compartment has a popliteus. Is one of the important muscles, and the flexor hallucis, that was in the medial compartment, anterior compartment, that was extensor compartment. Now the posterior deep part is also called the flexor compartment. Flexor hallucis longus, flexor digitorum longus. That was in that time, that was tibialis anterior. Here is the tibialis posterior. These four muscles supplied by also the tibial nerve. I already said to you that posterior compartment, that is superficial and deep, both are supplied by the tibial nerve. Here the tibial nerve root value sometimes important, but tibial nerve, just remember that the name tibial nerve. Now the ankle and foot. Okay, so dorsal layer, that is extensor digitorum brevis, that is deep peroneal nerve. It is important. Sometimes there is a question that first interdigital cleft, there is a muscle adjacent to the extensor hallucis longus. What was that? And that is extensor digitorum brevis. It is also supplied by the deep peroneal nerve. See, the deep peroneal nerve only present in the dorsal aspect. It is a single muscle, not the other muscle. So this is an MCQ. Sometimes if the question is little bit harder, then these kind of questions sometimes asked. Now adductor hallucis, flexor digitorum brevis. Okay. Adductor medial plantar nerve. So these are this is not important because it important in the part B, in the deep of foot anatomy. Sometimes it is important for part B. Okay. No need for that. Okay, now very much important things. The greater sciatic foramen. So without understanding or good strong preparation about the greater sciatic foramen, no need to go to the exam hall, because without it there is no meaning of going to the exam hall. So greater sciatic foramen, that is nerves and vessels, some nerves and some vessels. Nerves like sciatic nerve, superior and inferior gluteal nerve, superior and inferior gluteal, pudendal nerve, posterior femoral cutaneous nerve of thigh. Now the nerve to quadratus femoris, nerve to obturator internus. So a group of muscles and vessels come from the greater sciatic foramen. Here it is the greater sciatic foramen. Here this is the greater sciatic foramen. So this foramen consists of some muscles and some vessels. If there is no pictures, but I can show you. Wait. Here you can see the this is the greater sciatic foramen. So here this is the muscles, obturator internus, externus, and some of the vessels come from upper portion, some are from downward portion. So I will discuss here. So this is the things. So these are the structures I already seen to you. That is the sciatic nerve, superficial and inferior gluteal nerve, and the vessels is superior gluteal artery and vein, inferior gluteal artery and vein, and internal pudendal artery and vein. So vessels, nerves means these three things. Thus you have to memorize the things. Nerves: sciatic, superior inferior gluteal nerve, pudendal nerve, posterior femoral cutaneous nerve of thigh, nerve to quadratus femoris, and nerve to obturator internus. So another vessels is superior inferior gluteal artery and vein, which will give supply to the gluteal nerves. That is not nerve, gluteus maximus medius, and inferior gluteal artery and vein also give the muscles, and pudendal artery and vein gives the pelvic viscera. So I already told you that piriformis is the muscle which divide the sciatic foramen with the greater and lesser portion. So above the piriformis, superior gluteal vessels, and below the piriformis, inferior gluteal vessels, the sciatic nerve. So greater sciatic foramen, it has some boundaries, no need for that. And structure passing between the foramen, that is pudendal nerve, internal pudendal artery, and nerve to obturator internus. So these three structures goes both greater and lesser sciatic foramen. Okay, pudendal nerve, internal pudendal artery, and obturator nerves. And the contents of lesser sciatic foramen is the tendon of obturator internus, and the tendon of obturator internus, that is the content of lesser sciatic foramen. That is the tendon of obturator internus, pudendal nerve, internal pudendal artery and vein, and nerve to obturator internus. Okay, these four structures, because pudendal nerve here present, also present in here. So that's why these three things goes in both foramen. Now, fascial compartment of the leg. In short, I already discussed it, that anterior compartment of the thigh, which is supplied by the femoral nerve, and there these muscles present: iliacus, tensor fascia lata, sartorius, and quadriceps femoris. Is also corresponding artery, that is femoral artery. Okay, and the medial compartment, that is supplied by obturator nerve, obturator longus magnus brevis, gracilis, and obturator externus profunda femoris artery, and the obturator artery. So profunda femoris artery, one of the longest branch of the femoral artery, which is line S manners. If I have any pictures, wait for that. So let me draw. Here, this is the femur. So profunda femoris comes like this. It arises from the femoral artery, but it goes posterior to the femur, then comes anterior to the femur, then gives up like this. So these S manners, it is long course. It has a long course. Now the posterior compartment, that is semi-tendinosus, semi-membranosus, and the biceps femoris, which is supplied by the sciatic nerve, like it is also the branch of profunda femoris. So from the very posteriorly, when it goes posteriorly, it gives supply to the hamstring group. Then it comes to the medial compartment. So the profunda femoris muscle gives supply to the posterior compartment as well as the medial compartment. So that's why these medial and posterior compartment supplied by the profunda femoris artery. Also the obturator artery, but it has a small limited supply to the vessels. The compartment of the lower leg. So the compartment of the lower leg has anterior compartment, posterior compartment, and lateral compartment. That we already know that posterior compartment has two. Some are superficial, some are deep. The anterior compartment, that is deep peroneal nerve, that is tibialis anterior, extensor hallucis longus, digitorum longus, and the peroneus tertius, supplied by anterior tibial artery. And the posterior compartment, that is tibial nerve, muscles of the deep superficial fascia, popliteus, soleus, plantaris, posterior tibial nerve. Okay, and the lateral compartment, that is superficial peroneal, peroneus longus and brevis, and peroneal artery. Just remember, peroneal artery. Maybe it is a new term. Not usually, I didn't see any question about the peroneal artery, but today when I going to discuss about or they go through the EMRCS, I saw one question that which artery is lies lateral to the peroneus brevis muscle. So that was a peroneal artery. So you must know that. Now so these are all about the muscles and the bones. Now the arteries of the lower limb. So there are important arteries which it is lined as a short note, that is continuing as a dorsalis pedis. Mm, passes between the extensor digitorum and the extensor hallucis longus. So sometimes there is a question that anterotibial artery lies in between which muscle? So that is extensor digitorum and longus and the extensor hallucis longus. It is related to the deep peroneal nerve. So it is present within or adjacent to the deep peroneal nerve. It lies anterior to the middle third of the vessels and lateral to the lower third. So not need. Posterior tibial artery, now the larger terminal branch of the popliteal artery. So it is the continuation of the popliteal artery. So it has two branches, medial and lateral plantar arteries. So posterior tibial artery has two branches, medial and lateral plantar. Two veins within it, adjacent to it. Position of the artery correspond to the line down the lower angle of the popliteal fossa. So here, remember, it present in the popliteal fossa in the lower angle, just at the level of the neck of the fibula. So adjacent to the nape of the fibula, just lateral to the popliteal fossa, there is an artery which is deeply present to the popliteal fossa, deeply present. That is posterior tibial artery. So here the aorta, their branches, give supplies. Here the huge. So you have to see the artery alignment here with the radar nodes. So beginning as a femoral artery beginning in the middle, behind the inguinal ligament at the mid inguinal point, as a continuation of the external iliac artery. An upper half superficial femoral triangle, lower half lies the subsarterial canal. So it has a two half, superficial in the femoral triangle and the lower half is in the subsarterial canal. This is Hunter's canal. It is subsarterial canal is also called the Hunter's canal. Hunter's canal. Okay, remember same things. Now the terminations, the junction is upper two-third and lower one-third. The thigh is passing through the opening of the adductor magnus. So magnus, upper two-third and the lower one-third of the thigh is passing through the opening of the adductor magnus, become the popliteal artery. So femoral artery ultimately finished it as a popliteal artery. So you can say that popliteal artery is the continuation of the femoral artery after the subsarterial canal, that is Hunter's canal. Now the femoral artery has some superficial and deep branches. So three are the superficial, three are the deep branches, which is also important in the FCPS exam as well. That is in the January 2021. There is a question that is inferior epigastric artery is the branch of which branch? That is the external carotid artery. So it is a similar, that is surrounding vessels, that is superficial epigastric, superficial external pudendal artery, superficial circumflex iliac artery. These three artery derive from superficial branch of femoral artery. And the deep branch, that is the deep profunda femoris artery, deep external pudendal descending genicular artery. So genicular artery will give supplies the corresponding branch of the knee joint. Genicular artery will gives the collateral branch of the knee joint. If femoral artery is blocked, or if the actual artery of the knee joint is blocked, then genicular artery will give supply to the knee joint as a corresponding or collateral. Sorry, the collateral branches. So profunda femoris artery is a deep branch of the femoral artery, and the deep external pudendal, here the superficial external pudendal, deep descending genicular. Remember that very clearly. So these are all of the questions. And now the veins. Small saphenous vein. Without knowing the superficial vein of the lower limb, don't go for exam, because you will fall in danger if you don't know or don't know about the full venous alignment. So long saphenous vein harvested as a bypass surgery, removed as a treatment of the varicose vein. If varicose vein occurs, then superficial veins is stripped off, and the saphenofemoral junctions is, if incompetent, in that case the abnormal tortuation dilatation of the superficial venous plexus of the lower limb is called the varicose vein. So there is a valve related problem of the superficial veins. In that case, that affected veins must be stripped off to relieve from the problem. Originating from the first disease where the dorsal vein merged with the dorsal venous arch, so it is arises from the venous arch. At the knee, it runs over the posterior border of the medial epicondyle of the femoral bone, passes passes laterally to lie anterior surface of the thigh before entering the opening of the fascia lata is called the saphenous opening. So there are some tributaries: medial marginal, epigastric, iliac, external pudendal, just like artery. So short saphenous vein originating from the fifth digit where the dorsal vein merged with the dorsal venous arch around the lateral aspect of the foot, passes between the head of the gastrocnemius and muscle, a drained popliteal vein. Ultimately, small saphenous vein drained in the popliteal vein. Okay, popliteal vein. Very much important. Sural nerve is related to the short saphenous vein, because during the surgery of small saphenous vein varicose vein, in that case, during the stripping of the small saphenous vein, there is a nerve, that is sural nerve, which is usually or commonly injured, that is sural nerve. In that case, patient will suffer from numbness of the lateral aspect of the lateral malleolus, or behind the lateral malleolus, patient will feel numbness or paraparesis. So the saphenous vein nerve is related to the long saphenous vein below the knee, and for the reason full length of stripping the vein is no longer advocated. That's why full vein is not removed, because during this sural nerve is usually injured. So nerve of the lower limb. So tibial nerve number 4 to S3, quadratus femoris S1, 4, 5 to S2, peroneal number 4 to S2, superficial gluteal 4 to S1, and inferior to the 5 to S2. Okay, piriformis S2 and the femoral cutanea S2. So no problem. It is not usually come to the exam, but you must know. So neurologic features of lower limb: extension, abduction, adduction, flexion, extension. These are the movements. And the knee joint flexion extension, ankle is dorsiflexion. Dorsiflexion means like this. If I, mm, if I, so here the leg. Sorry, so let me erase. It's not like so much good. Oh. Okay. So if I write these, okay. So this is the leg. So dorsiflexion means it goes upwards. Plantar flexion means this foot will goes downwards. And the eversion means here laterally. Foot must go laterally, and inversion means medially. So which are the muscles is used? Eversion done by S1, that is superficial peroneal nerve, and the inversion by the deep peroneal nerve. You already saw the superficial peroneal longus brevis, deep peroneal. So it is also called the inverters of the foot. And the those who are inverter, those are also the dorsiflexion of the ankle. So two movements are done by this muscle. First is the inversion of the foot and the dorsiflexion of the foot. Both are supplied by the deep peroneal nerve. And the evertors of the foot and the plantar flexion of the foot is done by superficial peroneal nerve, that is superficial peroneus longus brevis. This is the dermatome related supplies. The genitofemoral nerve, small area of the upper medial thigh, arises from the first and second lumbar nerve, the L1 and L2, gives passes obliquely through the psoas major, the medial border of fibrocartilaginous between the third and fourth lumbar vertebra. Divides in genital and femoral branches. So genital branch gives supply to the inguinal canal within the spermatic cord, supply the skin fascia of the scrotum. It also gives scrotum, and the femoral branch enter the thigh posterior to the inguinal ligament. So this branch goes posteriorly, lateral to the femoral artery. It supplies skin fascia over the femoral triangle. It also gives supply to the femoral triangle. Pudendal nerve. So pudendal nerve is the nerve which holds the feces or micturition, because it is also it is the somatic branch of the pelvic viscera. There is a pudendal nerve arises from some sacral 2, 3, 4, exit the pelvis of greater sciatic foramen. It is also comes to, and then re-enters to the perineum through lesser sciatic foramen, both foramens. And it travels inferior to the give innervation of the anal sphincter and external urethral sphincter. So this is the nerve which holds the micturition along with defecation. So traction and compression of pudendal nerve by the fetus and the late pregnancy may result in late onset of pudendal neuropathy. Maybe process of development of fecal incompetence. So these are complications of normal delivery when the pudendal neuropathy occurs in case fecal incontinence. Sometimes after the pregnancy or late pregnancy, the mother cannot hold the feces due to pudendal neuropathy. In that case, during episiotomy, we will save the pudendal nerve by manual fingering. Now the femoral nerve. Femoral nerve innervated lumbar 2, 3, 4. These all like the same. Femoral nerve supply, there is a mimic, that is medial cutaneous nerve of thigh, that is Miss Vick scan for PE. PE, that is pectineus, sartorius, quadriceps femoris, vastus group, intermediate cutaneous nerve of thigh, saphenous nerve. So anterior compartment whole things is supplied by the femoral nerve. Obturator nerve, same root value lumbar 2, 3, 4. It descends on the obturator internus, enter into the obturator groove. Now this supplies medial compartment of the thigh, supplies the medial compartment of the thigh and the external obturator, adductor longus, adductor brevis and adductor magnus. Cutaneous branch is often absent and it passes between the gracilis adductor longus near the, so it passes between the adductor gracilis adductor longus near the middle part of the thigh and supplies the skin and fascia of the distal two-thirds of the medial aspect. So obturator nerve gives supply to the medial aspect of the thigh. That is very much important. But originated where the femoral nerve is also originated. Connects the pelvis and thigh, contains the obturator artery vein nerve which divides into the anterior and posterior branches. And this is the sciatic nerve, most largest or thickest nerve of the body. Sacral plexus, largest nerve in the body. Ventral rami lumbar 4 to sacral 3 gives supply the posterior aspect full. Adductor magnus part, femoral, hamstring group, posterior group, thigh, gluteal region, entire low leg except the medial aspect. At the upper part of the popliteal fossa divided in the tibia and femoral nerve. So these has two branches, tibial and femoral nerves. So here, the basic. Sciatic nerve divided in medial popliteal nerve, that is tibial nerve, and the common perineum laterally. So tibial nerve has posterior tibial nerve, it has a plantar, medial plantar, lateral plantar, and the complete tibial nerve. Now the femoral nerve is the superficial peroneal and deep peroneal. So deep peroneal will continue as a anterior tibial nerve, and the superficial peroneal or fibular nerve continue as a musculoudinous nerve. That is, it will go muscle towards the skin. Now the common peroneal nerve. So common peroneal nerve derived from the dorsal aspect of the lumbar 4, 5, S1, S2. And the nerve supply of the skin and fascia anterolateral aspect of the leg and dorsum of the foot. It also innervates muscle anterior peroneal, anterior and the peroneal compartment of the leg and extensor digitorum brevis as well as ankle and foot joints. The deep peroneal nerve, so or called the, it continue as anterior tibial nerve. 4, 5, S1, S2. It forms the common peroneal nerve at the lateral aspect of the neck of the fibula. Peroneus longus muscle. Pars is the anterior intermuscular septum compartment down to the ankle and midway between the two malleoli. Muscles tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius, extensor digitorum brevis. Okay, must know. Extensor digitorum brevis. First wave. It is very important. First wave of the digit supplied by deep peroneal nerve. It also comes from the FCPS exam. After its bifurcation, pass the ankle joint at the lateral branch of the deep peroneal branch in the extensor digitorum longus and brevis. Femoral triangle anatomy. Okay, now the triangles. So here the triangle. So this is the triangle. So what are the structures? Lies medially, laterally, floor and the content. Above the inguinal ligament, floor, that is iliacus, iliopsoas, and is a pectineus. Floor and medially, that is the gracilis, and the laterally, that is medial wall of the sartorius. They will united as apex. So what are the content? Content present as the femoral vein, femoral artery pulse, femoral nerve, deep superficial inguinal lymph nodes, lateral cutaneous nerve of thigh, great saphenous vein, femoral branch of the genitofemoral nerve. Very important, very good. It is very important. And the femoral nerve is not the content of femoral canal, femoral sheath, not the content of femoral sheath. So femoral nerve is not the content of femoral sheath. It is outside the femoral sheath. Now the deep and superficial inguinal nodes, lateral cutaneous nerve, great saphenous vein, and branch of genitofemoral nerve, that is femoral branch. So here the femoral nerve lies laterally, then femoral artery, medially femoral vein. Then this is the femoral canal. So this is the femoral sheath, this is the femoral canal, most medially. This contain deep inguinal lymph nodes or gland of Cloquet, gland of Rosenmuller. So iliacus lies posterior to the femoral nerve, and the femoral sheath lies anterior to the both iliacus and the pectineus. Now the femoral canal. Laterally, femoral canal is very important because femoral canal is involved in the femoral hernia. So sometimes abdominal contents go through the femoral canal, which is called the femoral hernia. His opening lies below and lateral to the inguinal ligament. So laterally, there is a femoral vein, and the medial wall is lined by the lacunar ligament. Very important. Lacunar ligament is very tight during femoral hernia. When femoral hernia becomes strangulated or obstructed, in that case, lacunar ligament is cut down to release the pressure. That's why after releasing the lacunar ligament, there will be a reconstruction of the femoral hernia repair. Anteriorly, inguinal ligaments, and the posteriorly the pectineal ligament. Content is lymphatic drain vessels, content of Cloquet and lymph node. Physiological significance allow the femoral vein to expand, increase venous return. So lacunar ligament or femoral canal, that is, it acts as a reservoir sheet. You can see here the femoral canal here. This is the femoral canal. So it's medial to the femoral sheath. So contains lymph nodes. So it helps femoral vein to expand during venous return. When venous return increase, it will give pressure on the femoral canal, so it can expand it. Potential space femoral hernias. Okay, neck tight place in a high risk of strangulation. It is very important. So it is a pathological significance. Physiological is expansion, helps in expansion of the femoral vein, and the pathological expansion is the neck relatively tight to high risk of strangulation. So adductor canal, it is also called the Hunter's canal, subsarterial canal. Laterally vastus medialis, and posteriorly adductor longus and magnus, and the roof is sartorius. That is saphenous vein, nerve, and superficial femoral artery, saphenous nerve, and the superficial femoral vein. So these three structures: saphenous vein, superficial femoral artery, and femoral vein. Now the popliteal fossa. So another fossa, like posterior to the knee, that is biceps femoris above, lateral head of gastrocnemius, and plantaris below. And medially তোমার হলো semimembranosus, semitendinosus, and the medial head of the gastrocnemius below. And the floor, popliteal surface of the femur, posterior ligament of the knee joint and popliteus muscle, and the superficial and deep fascia. Roof, superficial and deep fascia. Okay. And the floor is the popliteal surface of the femur, posterior ligament of the knee joints, and the popliteus muscle. What are the contents of popliteal fossa? There was a popliteal artery and vein, small saphenous vein, common peroneal nerve, and the tibial nerve. Yes. And the posterior cutaneous nerve of thigh, genicular branch of operator nerve, and the lymph nodes. The tibial nerve lies superficial vessels in the inferior aspect of popliteal fossa. in the upper part of the fossa. Tibial nerve lies lateral to the vessels. And one thing is you must know that popliteal tibial nerve lies superficial to the popliteal fossa because just adjacent to the skin, and the most deep part is popliteal artery. So popliteal artery is the deepest structure in the popliteal fossa. And this is popliteal tibial nerve, most superficial, and the popliteal artery is most deep. Now the pudendal canal. The pudendal canal is located along the lateral wall of the ischioanal fossa in the inferior margin of pudendal internus. It extends from the lesser sciatic foramen, so I already discussed it. Now the foot anatomy. Foot anatomy is not so important for part A, it is also important for part B. So no need to worry about this. Just you must know this. That is, inversion is done by tibialis anterior and tibialis posterior. Okay. So deep peroneal nerve and tibial nerve is helps in inversion. These two muscles are the prime muscle. Dorsiflexion tibialis anterior extensor digitorum longus, extensor longus. Also deep peroneal nerve. Okay. And the eversion peroneus longus and brevis. And plantar flexion is also superficial peroneal nerve and the plantar flexion, that is tibial nerve. Posterior compartment. So compartment helps in plantar flexion and anterior compartment in dorsiflexion. Eversion, eversion is the complex phenomena. Both anterior and posterior compartment tibialis muscle helps in inversion, and eversion is only peroneus longus and brevis supplied by superficial peroneal nerve. Hip joints. Now the joints. Joints, there is a mimicking hip rotators. P go go Q. That is piriformis, gemellus superior, obturator internus, gemellus inferior, obturator externus, and quadriceps femoris. This is also P go go Q. I already told you about the rotators, so it is a mimic to remember this. So there are three extracapsular ligament: iliofemoral ligament, pubofemoral ligament, and ischiofemoral ligament. This is the strongest three ligaments which helps to attach the head of the femur with the synovial joints. Ligament transverse ligament, head of the femur, ligamentum teres. It is the only femoral head supply in the childhood. Contains artery supply of the head of the femur in children, because in the later age this artery is obsoleted. Acetabular notch. So head of the femur is ligament. So here this is the ligamentum teres with the head of the femur with the acetabular notch. There is a question. So blood supply: median circumflex femoral and lateral circumflex femoral arteries, branch of the profunda femoris. So medial circumflex femoral and the lateral circumflex femoral artery, the branch of profunda femoris. And the nerve supply of the lateral hips, that is piriformis, same things, no need to understand. So just remember these three things. And the normal angle between femoral head and the femoral shaft is 130 degree. Femoral whole femoral head is acetabular labrum. Now the knee joints. The ankle joints, knee joint is a sign of the largest, most complicated joints. Two condylar joints between femoral and the tibial, stellar, patella and femoral. Patella and the femur. Then the tibiofemoral articular surface are incongruent. Okay. So there is a measures of menisci. So tibiofemoral joints is the actual joint composed of patellofemoral joints, lateral and medial compartment. And the synovial membranes crucial ligament partially separate the medial and lateral compartment. And patellofemoral ligamentum patelli provides joint stability, full extension. Patellar ligament. There are some bursa and the ligaments. There are five ligaments: medial collateral, lateral collateral, anterior cruciate, posterior cruciate, and the patellar ligament. There is a meniscus, medial and lateral meniscus comprising congruent femoral and tibial condyles. Medial meniscus attached to the tibial collateral ligament, and the lateral meniscus attached to the loose fibers. The lateral edge of the joint separate the fibular collateral ligament. So here, the ligaments with the complex joints, carved like fibrocartilaginous joint, hyaline cartilage. But meniscus is fibrocartilaginous origin. No need for that. Now the ankle joints, not important. Here, very important. The last topic. Structure posterior to the medial malleolus and the structure deep to the external retinaculum. So deep to the flexor retinaculum, deep to the extensor retinaculum. What are the structures? Anterior, that is in the anterior portion of the foot, there is a tomcat, very nice dogs and pigs. Tibialis anterior has Tom has very nice dogs and pigs. Tibialis anterior, extensor hallucis longus, antertibial vessels and nerve, extensor digitorum longus. So tibialis anterior and extensor hallucis longus lies medially. Then vessels and nerve, then extensor digitorum longus, and lastly peroneus tertius. And the Tom does very nice heads. That is posterior medially. Tibialis posterior tendon, flexor digitorum longus. Here the longus comes to the medial portion. Then posterior tibial vessels and nerves, then hallucis longus. Exchange only. So you must know these things because sometimes there is a relationship related question. You have to ask, you have to understand the mnemonics. Tom does very nice hat. Tom does very nice hat. It is actually working in the posteromedial aspect, and the structures deep to the external retinaculum, that is anteriorly. Tom has very nice dogs and pigs. Tom has very nice. Tom does very nice hats. Another one is Tom has very nice dogs and pigs. So very and does and dogs, it is sometimes aligned. Here is a mystery. You must know the mnemonics to avoid unusual wrong answers. Now the surface anatomy. Surface anatomy sometimes needed for Part B exam to identify these structures, nerves and vessels. So this is all about today's presentations, and the discussion is about the MRCS study with me. So thank you very much. Till then, tata. Thank you very much. Peace.